the daughter of Dr. Dick Bersendahl, the founder and developer of contact reflex analysis. And he was also the founder and developer of the formulas for Vervita products. And I want to welcome a beautiful, wonderful chiropractor friend of mine, Dr. Melissa Kroll, and she is one of the very first CRA certified healers out there. We had our first certification weekend in 2023, and she is one of them that just knocked it out of the park and has a very busy practice, very successful and well sought after. So welcome, Melissa. I'm so glad you could join me on this kind of conversation that we're going to have.
Thank you. I'm excited. I always love chatting with you. So this is going to be fun.
Oh, we have fun. We have fun. So
Always.
anyway, first of all, tell me, and I don't, I know you, but tell us, everybody watching, a little bit about you, your background, what you do, and also how you heard about contact reflex analysis.
So I am a chiropractor, like you mentioned, but I like to say I'm not your average chiropractor. I do a lot of all holistic approaches for health. My practice is actually right now majority virtual. I'm doing about 80% virtual patients and then 20% in person in Charleston, South Carolina. And I work the structural component using my chiropractic degree and then also going to the emotional nutritional factor. And that is where CRA just wraps everything right in. I actually heard about CRA from my brother-in-law, Dr. Charlie Fagenholz, who was one of your first getting started people into the CRA world. And he introduced it to me by treating me with it. And then as soon as I started chiro school, CRA was one of the first seminars I ever attended back in 2019 and pretty much have been roped in since and attended like 7 seminars, I think, to date, whether it be in the seats or helping you out or helping whoever is teaching it out, but definitely could not stay away.
Just so you know, I always appreciate it when you're helping me. It's always great. It's always great. So how do you integrate? You had mentioned you do online and you also the virtual and in person. So you have many tools in your toolbox, and I know that. But how do you integrate CRA into all that, whether it's online or in person?
Yeah.
How does that help you? What do you do?
CRA is actually like the heart of my practice. If I want to use like CRA terms, like I definitely revolve everything. I don't know what I would do without CRA. Like that is the backbone of everything. Every single person, whether you're in person or virtual, I am using CRA, going straight into asking whatever the priority is. And that is what the basis of CRA is when you go into urgent wellness. And I use my other tools that I have in my tool belt. So using my chiropractic degree or other techniques that I have in structural or emotional components when it comes to NET or other emotional factors, and then nutritional background. So what I've learned in school, what I've learned in other seminars when it comes to getting rid of any toxins in the body or anything that's a chemical imbalance. And I use CRA in every component of that. So when you learn the CRA technique, you learn not only the approach of structural, emotional, nutritional, but you also learn how to figure out what comes first, how to approach it, if that completes it all the way. And then after that, depending on what you're going for, so let's just say if it's a bacteria aspect in the nutritional realm, you have to figure out if you cleared it all the way, if the person can handle it. And then you want to make sure the heart goes back to that perfect score. And that comes into, again, the scoring part of CRA, which I constantly use all the time. And I know that my patients all joke with me, whether it's virtual in person or the kids always laughing, like, is all you do is count, because I'm always just scoring everything and always in the practice to make sure the person's walking out with getting the best protocol they have on hand.
Wow. You covered a lot just in that blurb there and how you integrate it into your practice. And I'm like, woo, boom. Let's go back. And you had mentioned in your practice, you utilize balancing the emotions, the nutrition, and the structural aspects of it. And that's pretty unusual for one healer, one doctor, to be addressing emotions, the chemistry, and the structures of it. But yet in CRA, we call that the triad. We understand that each aspect of it has to be in balance for the body to heal. And you're talking about how you work to bring balance to each one. Now, let's just take emotions. Let's just play here a minute.
Sure.
So you're working. Yeah, you're working on somebody and emotions comes up as a priority. What would you do? What are the tools in your toolbox that you can use? Because CRA helps you figure out which tool to use. The right thing at the right time is what I like to say.
Oh, always. And exactly. So going off the emotions within just using CRA itself, you learn about the essential oils and the nutritional products of the Vervita line. And that's something you can use to help clear emotions. You have the oils that every single oil hits a different emotion, different organ support. And I rave about them and talk about it to my patients all the time. And then the nutrition, even people don't realize it, but the nutrition helps your emotions. So like cleanse, for example, literally incinerates the aspects of the emotions. It works through that. Look at calms. It calms your nervous system to calm your body when you're in those emotions. So when I go through and using CRA to give me the toolbox, to give me my menu, once I'm on that triad and I hit the emotion piece, I personally have a few other tools that I'll throw in there if I do neuroemotional technique or any other maybe homeopathics that I've learned or picked up along the way that I work through my patients when it comes to the emotional manner. And then I use that CRA to make sure whichever one muscle tests first, it will drop on the priority. So I know that whichever one's coming up. So if it falls on oil and the next thing it falls on is present moment oil, that's the first thing that person needs to help their body, healing the emotions.
If I'm correct, for emotions, you would test the person to see what do they need first.
Yes. And if it I love using the example with my patients. A lot of times NET doesn't test for them. One, if the person is more closed off and doesn't want to share right now, they're not in that stage of their healing process. Or sometimes their nervous system doesn't understand it yet. And that's when black cumin tests all the time. And it hits on black cumin. And next thing it's because they're feeling blah, they're melancholy, they're working through the emotion more so than they can just like blurt out to me if I'm doing NET with them. Maybe they can't connect the dots quite yet. So then maybe they need to do a few baths or foot baths of black cumin or do it by mouth. And then next time I see them for their next appointment, when I'm muscle testing them, maybe NET test that time. And now we're clearing the emotion. And sometimes I actually do both. So to go through clear the emotion part of that triad, sometimes I'll clear with an oil and then make them an oil protocol. And then maybe we'll do one round of NET as well. Not every person's the same. It really depends on what they're coming in for and what urgent wellness or what state their body's in. And sometimes people can also handle more than other people at the same time.
Yeah, perfect. So you listen to their body. And
Exactly.
and a light bulb sort of went off for me when you were talking about the black cumin, and that's very gut oriented within the context of CRA and emotions. It's melancholy. We use that words, but when you think about it, what is that melancholy feel? It's stuffed emotions. They're not ready to do an NET round with you.
I don't
They're
want to talk
dealing
about it yet.
the stuffed emotions. So you have to get that body ready energetically to be able to share and release.
As I'm explaining to my patients in general, when I talk about the triad of health, I show them an equilateral triangle, showing them my hands, telling how everything has to balance off. And once we get to the chemistry side of finishing the nutrition, you want to make sure their nutrition is optimal, just like everything else on that triad. So of course, I always offer the Vervita line, but I work with a few other products, whether it be homeopathics, herbs, going off of just nutritional aspects if it's one or the other, more individualized. So I have a whole menu that CRA now let me get, and I'll just muscle test going through, like, do we need an herb, a nutrition, an oil, homeopathic spray, a homeopathic remedy? Is it something that it's an allergy? I'll go through all different factors as I'm muscle testing. So whether I'm muscle testing the person in person or doing it virtually, I'm asking down my whole menu that CRA just led me to and finding what the exact item that person needs. And then even better is now muscle testing how much they need of it, how long they need of it, how much they can handle of it. Are they actually going to use the full 2 capsules or do they only need one of them? And that's where a lot of times you don't learn that in other techniques of like, how many do you give them? Or are you just following the back of the bottle? And most people don't just follow the back of the bottle, because if they're taking more than one thing, sometimes you're balancing both of them. Or if they're in a really chronic, high inflammatory, high histamine state or whatever they are, they might not be able to even handle the 1 capsule. Maybe you have to start them on half a capsule, even though they're an adult, and then work their way up to the 1. And that comes over time.
I get questions a lot through the Vervita thing. How many do I take? And that is very challenging for me to answer because it does say on the bottle, here is a serving size. And
Mm-hmm.
so Vervita is, I will say, it's very safe. And typically people the scuttlebutt out there by from the healers is 1 capsule per 50 pounds, and you can work your way. So that's very, very general, but I love it with CRA. You are able to test exactly what that person needs along in the context of they might need more than one thing because you put things together, it has a synergistic effect,
Well,
right?
and once, let's say you test and you were finding that they need Cir-Q Tonic and they tested for 1 a day for 6 weeks, but now I can go in to use more of CRA and score out their nutrition, and their nutrition only scores an 80. So I know that that's not all they need. And now I'm testing to see, do they need nutrition and herb and oil homeopathic spray? I go through my menu again that CRA led me to. And once I know I'm complete is when that nutrition score is that 90 times 5. So I know that now they're walking out the door with a complete protocol. Their nutrition is top notch. And I'll see them again in whatever, if it was 6 weeks, then I'll see them again in 6 weeks to check in, or less, depending on what they're showing for.
I'm sure you get it, and I've gotten it myself, where people will go to their local GNC supermarket, whatever, and they've read something online about you need X amount of vitamin D, you need X amount of C. So I remember one patient that came to me with her husband, one of the one of the times they came in, literally brought in 8 grocery bags worth of supplements for it. And can you speak into why you choose Verbita over what's better about it than something else going into the local GNC?
I'm laughing because I had a patient, the same thing. He brought in, like, he booked an appointment with me just to test like probably 3 boxes of supplements. That's all we did for the whole appointment. And I scored each supplement so he would know even if it was a good product to even keep. So I'm right there with you on when that happens with patients. But Vervita is a trusted line. You know exactly where it's being sourced from. You guys are creating these products constantly. That's why sometimes things fall out of stock and we have to wait for them to get replenished, because they're not just sitting on the shelves. You know that you're getting something that's fresh, and we know it's clean. It's not coming from somewhere where there's heavy metals in the soil and now these products are contaminated. Versus when you're going to these other stores and you're just buying something off the shelf, one, how many times do you really flip it over to look at the expiration date? Like, is it cutting on the cusp and you're going to be sitting on something that's expired? And then two, what are they getting it sourced from? Is it rancid? Are these even good products? Or are you even taking something you even need in the first place? Because a lot of those ones that you're going to pick up, they're mixed with other things, which is okay to have mixes. That's what Vervita does. It's mixes too, but they're mixed in the correct way to balance each other, where you're not getting out like an uneven balance of what you need. And a lot of times my patients will do the same thing. They're like, oh, well, I could just get this vitamin D in my other office. I'm like, well, why would you pick it up there when you can get a clean source right here? And this is now going to wrap around and support all the organs or all the nutritional aspects, depending on what the product that they're testing for.
I don't think everybody understands that nothing works in isolation. So when you take a single vitamin into your body, it needs other vitamins and minerals in order to work. So, and that's what my father, Dr. Dick Bersendahl, worked really hard at, understanding how to create the synergistic effect by putting these formulas together.
Which, like, your heart goes to them because you know how much money they just spend on all these products. Or like if you're
Yes.
coming from seeing other physicians, and that's usually like the patients I get. They've seen all these other people. They're like, can you actually help me? I'm like, well, do you want to try this together? Because we're on this journey together. I'm happy to be right alongside of you, but they're depleted. They've tried so many things. So when you have, like, they're coming in, they don't want to buy new supplements, but the catch is, it's like, those weren't the right supplements for you. And the goal is now we're muscle testing to find the correct supplement for you at this time for the stage you are right now when you're walking into my office, and how that's going to impact you for the next month, going into months, going into years, as you keep this journey on and you keep healing as you keep going.
And so when they do come in with their bags full of things, they have been searching and researching and doing the work and spending their hard-earned money on things. Why? Not just because they wanted something on their shelf. They are searching for healing and what's ultimate, hope. They're searching for that hope. So those bags of nutrition to me represent hope that was crushed, hope that was crushed over and over again.
Even
Yeah.
sticking with that idea of hope that was crushed, like, a lot of times when those are the people I'm having Royal Wonder be one of the first oils that test for them, because they've gone through that journey. They've had that trauma aspect for them, whether it be with that older other physicians or whatever even caused the trauma in the first place. And most of the time when, like, that hope's crushed and they're they're depleted with all those supplements. Like most of the first things I'm asking is like, do you have a history of trauma? Is one of the things I muscle test. And if it comes up, yes, I'm like, do they need Royal Wonder? If it comes up, yes, that's the first thing on their protocol. They're either doing Royal Wonder topically, they're doing it in a bath or whatever that might be. And that automatically usually makes it where they even feel the shift. I'll even like, if they're in my office, I'll open it and they'll smell it and they're like, and you can just see their nervous system start to relax as soon as they smell that oil.
That to me makes my heart go, oh, you know,
Mm.
because we care about these people. We care. That's what we do. And we use our tools in order to bless them and, you know, put them on that journey of healing that God created all of our bodies to be able to do.
Yeah.
So, yeah, thank you for putting that one together. CRA also helps with the structural aspect of it in figuring out how to open up your toolbox and what are you going to do for that person if there's a structural imbalance. Now, first of all, tell me the tools you have in your toolbox that you are able to address structures with. Just tell me your tools.
So my toolbox for my structure, I do quantum neurology, which is me a nervous system, like neurological rehab, that I incorporate in. I use other applied kinesiology techniques. I use CPK as well. I'll go into like acupuncture points. I even sometimes throw chakra aspect into a structural piece, and then go into using my chiropractic degree. So I'll use soft tissue stuff, chiropractic adjustments, organ flushing, going into the CRA aspect of the structure piece, and using nutrition and oils are just some of the things that come to mind. And then on top of SRT or other technologies that I have.
So you have quite a, and I call it a toolbox. These
Yeah.
are it's an option, and CRA is able to put all these things on a menu for you so you can determine what to use first. So tell me how that is helpful to you. You've gone to Dr. George Gonzalez, you're certified in QN, you've gone for years into training and you're a chiropractor, you've done CPK. How do you figure out what to use? That's a lot of doctors go, I have all these skills and tools and I'm just going to dive in and do it. How do you use CRA for it?
That's exactly why I recommend CRA to any new doc, any doc that asks me, because in school they teach you how to adjust someone, but they don't teach you, like, other than palpating, that's all you got. Like, they don't really teach you how to use it. And CRA has been wonderful because, again, you give me that menu. So if I'm muscle testing and the structure aspect comes up, now I'm throwing my menu. I'm putting all of my options, those tools I just listed off, and I'm seeing, I'll just list them off. And I usually say everything out loud so my patients can hear me. And then next thing you know, if it falls on QN, then I'm now going into my QN protocol and I'm asking my QN stuff. Once I treat a certain aspect, then I'll go into the scoring. So if I just fix their cranial nerves with quantum neurology, next thing I'll be like, okay, now their structure scores a 10, 20, 30, 40, 50, 60, 70, 80. Ooh, there's still something there. 80 is now a structural piece still. Maybe I need to adjust, and I'll go through my menu, and next thing you know, if it's adjust, then I'll use my chiropractic aspect and I'll figure out where I'm adjusting. So then I'll either go into scoring more to figure out specifically on the body, or I can just ask, like, is it like upper body, lower body, extremities, whatever that might be, and ask the body what it needs to be. So I know exactly I'm adjusting what it is. And I even go to the extent of like double stacking. So before I adjust someone, I see if there's an emotional component attached to it, because if there is, then I'll release the emotion while I'm adjusting some. So whether it be with NET, having them smell an essential oil, but if I'm adjusting, for example, like their C2, giving them a cervical adjustment, I'll make sure it's not just only structural, because if not, it's going to come right back.
Ooh, the power of stacking. Love
Yeah.
that. That's pretty amazing. So when you're doing that, and you were talking about counting and stuff like that, people who are listening don't know CRA. Just a quick overview. With contact reflex analysis, we do something as scoring, and everything's frequency. There's certain numbers, scores that are put to completion, to organs optimal balance, etc. So she's talking about counting everything, and basically those scores indicate to you if something's in balance or out of balance, if something is complete or incomplete. How do you describe CRA, what you're doing to a new patient?
So I have like a new patient like script pretty much at this point, but for most of the patients, they're coming in and they're at that aspect of, this is like my final straw. I'm just ready to hear it. So everyone's really open. So it's really nice where they're just being like, let's try it. But anyone in person, I actually do a demonstration and I muscle test show them what a muscle test is and how it feels like. And then I'll explain what they'll see, and I'll explain the CRA aspect of it, of my tools that I'm using. And I'll talk about, there is a triad of health, and it works at the structural, the emotional, and the biochemical level. You have an equilateral triangle. They all have to be balanced on all sides. If one side is now broken, you're no longer a triangle. Your body's no longer thriving. Contact reflex analysis looks at that triad and makes sure that we're balancing all three sides to make sure everything is nice and equal. And when you talk about that, then I'll go into asking people their nutritional history, talking about nutritional stuff. So just even the aspect of diet, clean water, clean air in their home, going into the emotional side, any stressors that they know of, or they're telling them about the NET and other QNRT and other techniques that I do that are for emotions. And then we'll talk about the structural piece. Like if they already see a chiropractor, they work with acupuncturists, and I'll talk about my tools with that. But then I'll explain to them how the technique is contact reflex analysis that I'm using. And then I always laugh because the kids always are like, you're just counting out loud. And they're all I do is count, which is true because I'm using the scoring aspect of CRA. And I tell them that is my way of making sure that their body is walking out like the door with that 100%. So I'm always joking because I think you joke about this during seminars too, is that it's a 90. A 90 is a perfect score. We learn in school, 100's perfect score. In the place of my office, 90 is a perfect score. So my goal is to make you always walk out the door in that 90 or whatever that is that I'm testing out for you. So I always will count out loud to make sure you're getting the best thing. And then the best way to learn and see it and understand it is literally by just experiencing it. And that's where I kind of leave it for my patients and let them go through it, because I talk out loud through my entire appointments. Most of my patients, I've only had like one probably tell me not to do it. Everyone else loves it because they then understand what I'm talking about. Or if it's a mom listening to the child, they know exactly what's going on. And then they're along for the journey and they're learning. And then now little get to understand more. And when they come in for my appointment next time, they're like, oh, what is their blood quality score today? And I'm like, funny, they're keeping track themselves. Like they want to know exactly what it's like. How's their brain doing today? How's their functioning? I'm like, well, good. Like, let's make a comparison. So like the mom keeps notes, I keeps notes, and like, I want to compare it. So maybe in 6 months from now, I can go back and see like, wow, this is how you feel, but also let's look at how your numbers are.
It's one thing to have symptoms start to go away, relief of symptoms, definitely. But just because there's no symptoms doesn't mean that you're balanced. It
No.
doesn't mean you're balanced. The scores will tell you, and it's kind of like, oh, yeah, let's keep going. What is your favorite Vervita supplement, essential oil, cream? What's your favorites, and why?
That's such a hard question, I'll be honest. I like sat on that and I was like, wow, I don't know. Like, it's like in life, I've gone through so many phases, even just like since 2019 of being like involved in Vervita. I've gone through chiropractic school. I've gone through opening my own business, moving to somewhere new all by myself, living in a place that was moldy. So I've gone through all these different things where like I've had favorites for like certain months. So like I'm coming off the months where like I was living, breathing black cumin. Like I had bottles across my entire condo, like every single room. I had black cumin in my fridge. I had black cumin. Like I was taking it by mouth. I was bathing in it, you name it. I was doing everything with black cumin. So like, I know that like that probably right now is like my go-to. On top of it, supports your hormones, supports your blood. So on a female aspect, it's great. So like, it just was what I needed for the past 6 months of my life or so. And it also is wonderful for other people because it's so broad spectrum. It has very many benefits. It's really easy to use. It's great for all ages. It's great for the skin. I found that to be like the most multi-purpose. I travel with it everywhere I go because you're always going to stay in hotels, Airbnb, something that you can't control. There's mold in that place. You want to make sure you have that to clean the air you're breathing in, but then also take care of yourself when you're there. Or even like when you're out traveling and if you get exposed to some type of stomach bug, it still has the antimicrobial aspect of it. So now you can help clear away the bacteria you might have just eaten to help your body get replenished so you're not knocked down as much. So I guess like right now, that's probably my favorite. Ask me
There
in
you
6
go.
months, I might have a new one. Ask me about like a year ago, I have a total different one that was my top of my line.
So, in what ways can they use black cumin? In these ways that I'm asking you, it's for any of the Vervita essential oils, but
Yeah.
let's just talk about black cumin.
Yeah.
How would they use it?
Most commonly, I feel like black cumin tests by mouth for most of my patients, maybe just 'cause I live in the South and everyone's surrounded by mold. But commonly by mouth, it replenishes your blood, gets rid of all the bacteria, gets rid of the fungus, candida, provides your body that natural iron and vitamin B and all of those aspects. So it's pregnancy, breastfeeding safe as well. So it really works for everyone. And doing it by mouth, mixing it with a juice, a water, whatever it might be, and drinking it that way, especially now that black cumin has a dropper, it makes it even easier for people to take.
Now
Uh,
you're talking drops by mouth, not tablespoons or
No, I'll
right?
muscle test for my patients the number of drops. It's rare that the drops are hitting in the 20s, 30s. If they are, it's usually for 1 to 2 days. And it's most likely, for example, like they just got hit by something, they're really coming over a sickness, or the female just went through their menstrual cycle, or maybe had a miscarriage. And now we need to really build them up from all the blood loss they had. And that's a lot of, I work majority with a lot of females, and that's definitely something I've used in that situation with black cumin. Another way to use black cumin is using it in a bath or a foot bath. So I love to always promote baths whenever they test as much as possible, even if people don't like taking them, as long as they feel safe in their bath. Your body's submerged all the way in the water and the oil, and you can use that with Epsom salt, mixing it with other Vervita oils or just by itself. But you can do the same thing in a foot bath if you don't have a bath in your home, or if you're out traveling and you don't have a bath. And then diffusing it, this is what I was talking about when it comes to hotels and stuff. I don't usually travel with a diffuser, but you can drop black cumin drops into a cup and use it as like just an open diffuser in the room. I actually, a lot of times when I'm traveling, I'll do black cumin and Elite Harmony together, because usually if you're in a hotel, there's also EMF aspect and radiation. So the Elite Harmony is working on the protection of that to diffuse into the air and whatever else might be in the room. And using it just as a natural diffuser, open the entire time I'm in the room. And then the other aspect is going to be, you can do it topically over the skin. So I always muscle test, is it a heart, spine, extremity, organ over a reflex? If it's a reflex, I'll figure out which reflex it is, and I'll go through and figure out where in the body they need to do the oil, how many drops, and for how long they're doing that as well. And when in doubt, the oils usually guide you on Vervita. You guys do a great job of helping everyone understand like what these oils are good for. And then when in doubt, you can apply it over those oils or wherever you're feeling it. Like your stomach hurts, put it over your stomach. You have an achy stomach, like go directly to that spot that's bothering you.
If somebody wanted to build healthy blood, where might they put it topically?
A lot of times it goes over the spleen. The spleen would be right over your left rib cage. So I'll actually, I usually tell my patients, I'll send them like a diagram of a body, and I'll just like be like, okay, it's right here. And they're all labeled by the organs. Or I'm like, literally Google where it is if they ever question it. But when in doubt, cover more area than none. So if you are unsure exactly where it is, and go over that left rib cage and cover your whole left rib cage right below your breast tissue is what I'll guide them to do, because I'd rather them hit the spot than miss the spot. A lot of times also, like a lot of times with replenishing the blood, if it's a female, sometimes I go over the uterus as well. And it will be in there as it's just like helping depending where they are in their cycle, or if it's like going to be a pre or post pregnancy aspect.
Now, if you had to choose a favorite Vervita supplement, what might it be?
I'm going to go with Cir-Q Tonic.
Okay.
And that is for the major purpose for myself of I travel a ton, and Cir-Q Tonic has definitely kept my body really thriving when all those travels come up, because of the hydration factor. It hydrates everywhere in your body, supports your bladder, supports your liver. And when you're traveling, you're bombarded by so many toxins, whether it be the radiation of the plane or the hotel or something that you're in. But even that, like you can be getting chemical toxins of fragrances, the not clean air, pollution, all of those things. Or if you're out traveling, you're not usually having control of your food as much as you want it to. So now you might be eating not organic stuff, something that has pesticides in it. And the Cir-Q Tonic's going to knock out every single one of those. So you're just basically covered by having that one product with you. So it helps your body start to detox it out, just hydrating you and getting things flowing.
So yeah, I
And
get it.
that's just like one of the reasons why I love it. I mean, like there's like it supports the heart. That's like the CoQ10 aspect. And there's so many other good things about the Cir-Q Tonic. That's just like the first thing of like what impacts me the most. Like I always have that in my travel bag. I have that with an SRT light with black cumin and Elite Harmony oil that I always travel with, and usually Gastro Digest, because I'm always going to be eating something I'm not normally eating, or knowing I'm going to go eat oysters or raw fish or sushi. And I'm like, I just got to protect myself.
Oh, you need that Gastro Digest. I'm sorry for that raw fish and sushi.
Yeah.
Oh, you're gonna need the gastro for that one.
Yeah.
Oh, you mentioned SRT. Tell me about that.
Yeah, I don't go anywhere without it. Literally, it's always on me. Literally always on me. I treat patients usually with 1 to 2 to 3 on me, depending on the day and how I'm feeling. but SRT is what we've learned through CRA, and it's honestly, it's the best thing out there. It gives you the frequency of healthy cells. So when your body is feeling depleted and you don't have that energy, it just really gives you that revamp. And for someone who does like what we do when you're treating patients, you don't want to carry someone else's energy, but you also have to figure out where your energy is to get you throughout the whole day. And I find this is like almost a backup energy to my body. It's like using it as my own battery in my heart to keep me going. And then on top of it, for myself, when I'm treating it to my patients, it basically helps their body get into parasympathetic mode. So it helps their body start to rest, digest, and heal. I've had many patients where like they'll come in my office, and if they're in that fight or flight dominant mode, I can actually just put one of my SRT lights directly on their heart before I start treating them, just to get their body back down. And then now they're able to be tested in a way better zone, and the things are applying better for them. Or they'll come in and wear the belt for 30 minutes during a protocol before or after their treatment, just because the benefits of SRT is just overwhelming. It just, when your body's in that like dark hole aspect, you hit rock bottom, SRT is like the first thing you can do to just grab a hold of it to get you back out of it, just by helping your cells get to that healthier frequency, whether it's one at a time or they start to grow really fast. Everyone's different, but it gets you out of there.
And I love what you said. I mean, people might not have even heard it, but you're holding up hold it up again, that one, that is an SRT optimizer, right? But you
Correct.
mentioned you wrap a belt around it. And how
Yeah.
many of those does a belt have?
So the belt has technically 13 loops, but technically a belt is more of 12 lights. And usually whenever you're wearing a belt, you need less time. So having one light on you versus wrapping yourself in 12 of these, it's a lot more efficient. So you're able to wear a belt for 30 minutes wrapped around your heart or wrapped around your bladder, wherever that stressor might be is for you. And it does that same thing versus you wearing this over your heart for the 10 hours of the day because you don't have the whole belt. But sometimes it's hard to wear a belt. Like I can't wear a belt while I'm treating patients. Like that's not practical. So I'll wear just one, but the belt aspect is something that honestly has saved me many times myself. Like I actually was rear-ended on Monday last week,
Oh
and
no.
it was a very much an energetic rear ending of like a wake up call for myself, but it really hit me. It was my first ever accident. Luckily, as you see, I'm sitting here, I'm okay. My car, not so much. It does not look pretty at all. The first thing I did is I texted Dr. Charlie, and he gave me a protocol, and the protocol was to belt SRT around my shoulder, like around my heart, underneath my shoulders, actually, have SRT on the back of my neck for the whiplash of going back and forward from the car rear ending me, and putting sore to sore on my neck. And I will tell you, I felt great the next day from just that protocol. Like it was amazing. I wore the belt, like it technically tested for 2 hours or more, like because like I know I had the availability. I canceled all my patients that day. I wore the belt definitely longer than the 2 hours. But even just after the 2 hours, I went for a little walk to get myself moving. And I'm like, this SRT is powerful. Like when you get into a whiplash injury, you can deal with concussions, you can deal with stiff neck, lots of range of motion. And I had all of that. Like the next day I was fine. I was treating the next day. Yes, I was treating virtually most of the next day. So I still belted myself to make sure I was energetically there and making myself going. But just from 2 hours after whiplash injury, and I was feeling that good, and it lasted on a week later, and it shows you right there, like the power of that SRT, because we all know that how fragile our nervous system is, how our spine is, how our brain is. And that SRT was able to get my frequency of those damaging cells to start to heal really fast.
Yeah, and the thing that, well, I'm number one, thank God you're okay. I'm very grateful. It's like, whoo. And the second thing is the fact that you even have this technology to offer to your patients is very powerful, very powerful. And you use CRA to score, how much do they need? How long do they need it? How many treatments do they need? Do they need nutrition support with it? Essential oil support with it? It's the whole, I say, personalized protocol that you create for each one of your patients. No two patients are alike, are they?
They are not. I actually had a patient who had her vision was she had a stroke that affected her eyes on top of she had like macular degeneration. She came in and we gave her a protocol. The protocol included SRT over her eye, 5 hours a day because we were just doing one SRT. And ideally when it comes to like eyes or teeth, a lot of times the long light works, but for patients, if they own one item, and I know that they're not the most affordable, like they're not the most cheap items to have, then we're doing the SRT, we're doing the optimizer, and she placed the optimizer over her eye for 5 hours a day. In 1 month, her vision changed from a 20/24, and that's with her vision like assisted lenses on already, to a 20 out of 20. So literally her vision went back to a perfect score by just 1 month of SRT and using some of the nutritional aspects, which is crazy. And that's 1 month. So I can only imagine, like, I can't wait to keep seeing like how things progress, because that's with her corrective lenses. I would love to see how we can keep her vision going. Now, maybe her corrective lenses prescription will continue to change even more and more. Well, we know you're a story person. That's why in CRA, when it comes to the emotional aspect, it goes like, I always go NET, a homeopathy, a story, because we always learn from you. Let's maybe they just need to talk about it. So I'm happy to share stories. I actually have a great story that involves more of like CRA aspect of numbers and scoring. I saw a mom who was 2 months postpartum who came in for me, and she had to have a C-section, which was not planned as part of her delivery method. And I treated her with urgent wellness, cleared out the urgent wellness part of her, but we had more time in the appointment. So then I wanted to make sure every single aspect of her triad was scoring at the 90. Her nutrition was a 90, but her brain and her structure scored as a 40. And a 40 in CRA, we go into that could be like a pain or injury. And the fact that her brain, and which could be emotions, and the structure aspect were equal, I'm like, all right, there's like a connection there when both numbers are the same. The first one the muscle tested that dropped on was brain. So I went to brain first to treat it, and she tested for sore oil. And we were doing that topically over her C-section star, also in a bath. And then also by mouth, mixing it with something else and doing that. And using that oil itself brought her up to an 80 on her brain and her structure. Again, they both increased together, staying parallel. And again, 80, we know in CRA world, is more of a structural piece. I ended up doing an adjustment and putting SRT on her, and she's coming in for an SRT protocol for more of that scarring and the C-section aspect. And also SRT still works the emotional piece. So with that protocol I created for her, then it brought her brain and her structure to that 90, which is what I wanted before she walked out the door. And I just love it because that's like the stuff where, like, when we learn CRA, like, you don't understand the numbers until you start practicing it. And then when you really memorize what falls under each frequency of those numbers, it really starts to resonate when like you're seeing the parallel. And like we said, the triad, they all have to be equal. So if we can balance it all together and they're connected, CRA makes it where you can get through those things and figure out the priority. So you can figure out what they need in that appointment first, so you can address it in the order they need it. And sometimes maybe if you do like 8 different techniques, maybe you don't actually need all 8 normally, because if you treat the first 2 first, the other 2 might not test anymore because her body doesn't need it or anything like that. And it really just gives the organization. It helps you be more aligned with a flow in your practice. CRA is definitely, it provides a flow. And if you're doing a lot or a little, it just helps you establish that pattern for yourself.
And it just reminded me of, I get cared for myself, and I went to a practitioner of CRA, and she was testing me, and it ended up being, I think it was under structures. And so she's testing through. She has quite a toolbox of techniques that she's really good in. So she's going through it, and she's going, not any one of those. I wonder, which one haven't I used in a while? So she thought about it. She goes, what about this? And that's the one I needed. And so I like to say, you know what? All your genius and your proficiency and your expertise does not go to waste using CRA, because she hadn't brought out that one technique that she did, I'll call it a tool, for a long time. And because it was like, it was in her energy field. That's what she's an expert in. So let's test it. And what does Dawn need? The one she hasn't used in a while, right? And so there it came up. Nothing wasted.
It's crazy. That happens all the time. That's why I actually have my tools written down on one of my sheets. It was actually I wrote on the notebook paper you gave us at certification, in that binder aspect, because so many times I'll be sitting there, I'm like, I went through the whole structure menu. I'm like, what am I missing? Like, what am I forgetting that I have in my mind as a tool to offer? And I just go to that sheet. And I'm like, oh, that's what it is. And then you'll be able to, because once it's in my energetic field and my knowledge, my body knows I can offer something else there. And then we just want to figure it out and keep digging.
That's right. So, yeah, you get to use everything you are an expert in, and you're going to use it at the right time. So, anyway, tell people who are watching, we've just talked for a while and this has been wonderful. If people want to contact you, what's the best way to contact you? Make an appointment, be a patient.
Yeah.
How do they do that?
So I am very frequent on Instagram. So finding me on Instagram at Dr. Mel Kroll. On there, I have my website link. I actually have a waitlist link there, so you can add your name and email onto the waitlist. If you want to, when you fill out the waitlist, you write virtual, in person, or either or, depending on what you're looking for. And from there, you also can get free tips. I constantly post different things, share other providers as well, because we have a nice community. We always want to make sure that our patients have everything. We want to make sure that you can also be your own provider for yourself and keep helping yourself along this route. And that's probably the best way to find me. And it has my website on there as well. My website does talk more about each of the techniques I do, but on my Instagram, I actually have video demonstrations of those techniques. So you can watch in my highlights. I have a virtual, I have a services one, and you can see what it looks like to hear me count out loud when I'm treating patients, whether that might be virtually or in person. You'll see me go through the CRA menus, going through CRA reflexes if I hit the urgent wellness, whatever it might be. And you can find me there. And you can always send me an email as well if you have any questions.
Perfect. Perfect. And I will say she does post some amazing things. She really does. So you
Thank
got
you.
to follow her no matter what. So anyway, thank you so much. I really appreciate you taking this time and chatting and sharing with everybody watching this. And so I am going to say thank you and goodbye until next time.